sonography of fetal urinary tract, otherwise by the condensation of sacral intermediate mesoderm, and by the ureteric bud, which appears dividing the cloacal compartment into two, one forming the urogenital cells, round or oval, slightly echogenic structures shown by the arrows on either side of the fetal. As on the axial scan, the transducer used is the convex broadband transducer, and if the urinary bladder is not seen, then scan has to be repeated to confirm whether it is caudal aspect, and you see the different structures, the posterior, anterior, and you see the bladder, the urethra, posterior urethra, anterior urethra, tip of color Doppler. You can see the jet in color as red, as shown by the arrow. That is fetal urinary collecting system. This is one way of classification. We will see one by one. They well shown, that is the lying down adrenal sign, and once you see this, you have to look for the ectopic kidney. If it is, you see the two kidneys on same side, and that is schematic showing the same. The incidence is 7.17. You see that the umbilical arteries are seen, but urinary bladder is not seen in between them, confirming that the urinary bladder, confirming that it is only soft tissue fusion of sirenomelia, and that is the 1,000 to 3,75,000 births. Now coming important marker which is very well appreciated, provided you scan to rule out that it is transient, and if it is persistently seen, it may be if it is may not be seen, there may not be complete emptying of the bladder, even if it contracts a little, or I mean it may be normal or decrease, and then assess the kidneys and indicating dysplasia of the renal parenchyma, resulting in non-excretion of urine here. So that is the features of bladder exstrophy. And incidence is 1 in 30,000 births. That is the dilated right ureter, dilated left ureter, and when you try to trace the distal ends of the ureters, you see that they become narrow and go ovary. So for that you look at the external genitalia. So the gender is female. So is it ovarian cyst? But a urinary bladder. So a second urinary bladder. So that is features of duplication of the urinary bladder. But what is interesting is there is independent emptying of the condition, and it is amenable for genetic diagnosis in that case. So what is the management? Repeated amnioreduction helps in solving. Having gone through the preview, if you wish to listen to the main lecture video, go to sonoshare.in.